I'm a medic, as you can see, and I was asked to provide a medical perspective on One Health and zoonoses. I'm a neurologist and I head the Brain Infections UK consortium, as well as Brain Infections Global, and I'm the director of the National Institute for Health Research, Health Protection Research Unit in Emerging and Zoonotic Infections, which Julian mentioned earlier. So we were heavily involved, and Julian is one of the theme leads in the HPRU. We were heavily involved in Ebola and Zika, and now, of course, COVID-19. But here's my puzzle. So I want you to chat in the chat function. If you've not seen this puzzle before, you can answer the question in the chat. If you've seen it before, then just hold fire. So the question is, what is the link? There you are, a nice simple question for people to have a go. Type away, anyone who thinks they know the answer. Okay, all right, I thought everybody would have seen this before, but that's good. So in which case, whilst maybe I'll ask the panelists, they can have a think about it as well if they want. There's one word that links all of these images. There we are, excellent, people have warmed up. Yeah, it's vectors, these are all vectors. And so to the mathematicians, that's a vector. It's sort of arrows and pointing things. To people like Julian, bottom left, a vector is maybe a plasmid delivering stuff. To the bug squashers, the entomologists, a vector is a mosquito. And then any of you with kids might show them this picture of Despicable Me. That's this orange thing is called vector, apparently. But the point is, we are working in an interdisciplinary area, and so we have to find a common language, which means when we're using terms, we have to make sure we explain them to each other. And here's another way of thinking about it. You'll all be familiar with the parable of the elephant and the blind men, or indeed blind women or blind people. And of course, they all feel one part of the problem, in this case, the elephant, and they all therefore imagine it very differently. And I think this really is relevant here, that humans have a tendency to claim an absolute truth based on their limited subjective experience, as they ignore other people's limited subjective experiences, which may be equally true. And I think that, you know, what we've just heard from Hayley and James does reflect some of that the different specialists tend to just look at things from their own perspective, rather than looking at the bigger picture. We've had one definition. I don't like any of the definitions I've heard so far, or at least they're okay. But for me, the critical thing is it's all about the fact that the health of humans and animals and the environment are linked, and that improving the health of one means we have to think about all of them. And the reason why I say that is because for me, that's the essence of One Health. All the other things, the local, the national, the regional, the multidisciplinary, the bio-behavioral, etc. All of that applies equally well to many health problems like cancer in humans, okay? But the critical thing that distinguishes One Health is that it's about the health of humans, animals, and the environment, and everything else is kind of common to many disciplines. Anyway, I'll move on. So I thought I'd talk about one example briefly this morning. And we've worked on many viruses, many emerging viruses over the years, many of which are zoonotic pathogens too. But I just thought I'd focus really on Japanese encephalitis because it illustrates many of the principles that we want to think about here, even though it's not a coronavirus. And I was asked to keep away from coronavirus because, obviously most people are going to be talking about that. So when I started working on this disease in Asia in the mid-90s, the wards were filling up with patients like this with clearly a brain problem. It wasn't clear what the causes were, how we could diagnose them and improve the diagnosis, and ultimately improve outcomes and maybe even stop it happening. It turned out that the virus responsible was this Japanese encephalitis virus, causes about 70,000 cases a year, and about a third of patients die, and about half of the survivors are left with brain damage. And you can see the area affected across Asia, and also you can see that it's a flavivirus, and there are other similar flaviviruses like West Nile, dengue, etc. Now here we are, this is a critical slide. So it's a mosquito-borne virus that naturally circulates among birds and then sometimes spills over into pigs. So it's a zoonotic virus, and humans are dead-end hosts. We become infected when we're bitten by an infected mosquito, but we don't pass the pathogen on further. And almost, there's a triangle, as there are for many of these conditions. So a large proportion of people have asymptomatic or just a febrile illness. It's just a small proportion that develops severe and fatal disease. And you can see there the image at the bottom of the kids. And if you live in rural Asia, you're going to be infected with this virus at some stage. But there are a range of factors that determine whether you will get ill. Now, in terms of understanding the zoonotic potential of this virus, you can see this is an old slide from 1969, and it was a guy called Scherer who did studies showing that what tends to happen is you get disease in pigs, and pigs miscarry, they have abortions, and then you if you're then looking at the mosquitoes, you'll see the mosquito numbers go up around that time, or certainly the number of mosquitoes that are infected with virus, and then human disease tends to follow. And in fact, for this disease, Buscher and Scherer really did all the critical early work in the 1950s, looking at the mosquitoes, mosquito factors, avian factors, the swine's involvement, human infection. They even did a survey of wild rodents, but didn't find much virus there. And they put it all together in the epidemiological correlations and conclusions. And in fact, certainly for mosquito-borne zoonotic viruses, we've been applying One Health approaches for 60 years or more, would be before the term One Health was adopted. But actually, overall, I think One Health approaches have been used for at least a couple of hundred years in thinking about human disease. Anyway, those guys were very busy. Here, I like this scientist who was less busy. This is a guy called Dr. Telford with his pet, is that a leopard? Pushpa. And you can see he only produced one paper, but he certainly enjoyed his time in Asia. And I'm pleased to say I enjoyed my time in Asia. I did manage to produce more than one paper. Now, sometimes with the medical students, the medics on the call will be familiar with the idea of a spot slide. And we show you something, a picture, and we say, what is this? What are you looking at here? Nowadays, I have to show people this spot slide and say, you may not be familiar with this, but this is a library. And in the library, you find real hard copies of journals where you find old papers. And as you've seen, sometimes some of these old papers are not even on PubMed and not readily accessible. But you do need to go back and look in the history books if you really want to understand a problem properly. So this, I talked about definitions of One Health. You can see here, they've kind of thrown in everything: comparative medicine, translational medicine, metabolic disorders in humans and animals. And, this happens quite a lot in science, doesn't it? You've got a nice crisp area that needs focus, and then suddenly everybody kind of wants to get involved, and it becomes so diffuse. You're more or less just saying they're biomedical science, aren't you? Which makes me think, well, what's the point? So I think focus is helpful. Just to come back to JEV and our thinking around One Health aspects of this. So this is the map of the virus. And then I came across this map not long afterwards. And this is actually a map of the distribution of this, the egret, the cattle egret across Asia. And you can see, I mean, you don't need to, be a genius to see that there's some overlap there. And in fact, the cattle egret, we now know, is critically important for the virus spreading to new areas. And indeed, I was in a hospital in Sarawak where we were working on JE, looked out of the window and rather depressingly saw, you can see here's the cattle egret, and just behind it is the swampy waters where these Culex Tritiniorhynchus mosquitoes grow. And I guess this is the moment when it occurred to me that, we really need to adopt these kind of One Health approaches. There's no point just waiting for patients to come to hospital to deal with these problems, and especially if you've got the perfect ecosystem to generate the problem sitting outside the hospital. So there's a range of factors here involved in emergence and presentation of patients with Japanese encephalitis. The critical question is, which of these might we be able to intervene to stop people getting sick and ending up in hospital and dying? I just thought I'd look at a couple of these in more detail. Climate change is interesting. This is Nepal where we work, and a lovely place to work, as you can see, fabulous place. And what we noticed over the years was that basically, originally, Japanese encephalitis was just seen in the Terai, in the lowlands here in orange. And then actually in the white areas is where you're going up into the foothills of the Himalayas. And the presumption was that basically it was too cold in the foothills to see much virus activity there. But then you can see, as time went on, that basically we did start seeing disease and virus activity up in the foothills of the Himalayas. And this, we think, relates to just a 1 degree temperature change in climate. Pretty topical this week, of course. Daniel in Poemville and Matt Bayliss looked at this more carefully and showed indeed that there are a range of factors contributing to the spread of virus in Nepal, including climate change, and then also factors relating to irrigation, etc. That was pretty unsophisticated modeling, but just to show you that, you know, we have done slightly more sophisticated stuff since then, looking in particular at Zika and the role of the climate change or climate events in precipitating the big outbreak of Zika in Brazil. Also back in Sarawak, trying to understand what was happening, we did visits to longhouses in these canoes, as you can see here. Really interesting stuff. And basically what we found was that in many parts of Asia, people are keeping their pigs very close to, or indeed in the home. And again, there's some evidence that this is actually contributing to why you get some JE in some cases, places rather than others. So here in Indonesia, it was found that in the Muslim islands with no pigs, there was greatly reduced JE. In Bali, more likely to see JE in people who are living close to rice paddy fields. And indeed, there's some evidence that intermittent irrigation of the rice paddy fields, so you drain your field every month or so, that kills off the mosquito eggs, and then you replenish it. And it actually improves your rice yield and may well help control the disease. So a number of areas where there is some preliminary evidence that this might help control the disease. But actually, when you do the modeling and look at it carefully, you realize the most cost-effective way to control the disease is with vaccination. And I was at some WHO meetings, so there were a range of vaccines. I was at WHO meetings where people were looking at the vaccines and constantly talking about developing new improved vaccines. And I made the rather grumpy comments that really, you know, why were we spending so much time thinking about new vaccines rather than thinking about using the ones that we have? And the Gates Foundation gave us some money to work on this, and we ended up vaccinating a lot of people and saving a lot of lives. So, and these are the people that did the work. So that was an example where really understanding all the different aspects of the, and applying a One Health approach to the disease meant that we worked out the most cost-effective way of controlling it, and it actually was human vaccination. I thought I'd better just show 2 slides of a different disease where the same approaches showed something completely different. So here's rabies. As a medic, I felt, you know, human vaccination is the most important thing to do. And clearly it is important, and especially for somebody who's just been exposed to the virus. But actually, the quite sophisticated work has shown, and we don't need to worry about the models, that the most cost-effective way of controlling rabies is to get the vets out there vaccinating dogs. And as you can see here in Sri Lanka, as the dog vaccination went up year on year in blue, then the incidence of human disease in black dropped right down. So they are 2 different studies showing you how One Health approaches will get you to the right answer. Those are the people who funded our work over the years, and I'll stop there. Thanks.